Oh. Introduce you to Hill. No, you said you wanted to watch it. That's what you said. Yeah, it's not a time for me to do introductions and all that.
But I know you said you wanted to keep Bill or something.
Hey, Deneen. Can you hear
Hey,
me?
Bill.
How's it going?
I'm good. How you doing?
Good, good. I'm just playing around. Good morning, everyone.
I can't really hear you, Bill.
Okay, I'm trying to jump on another end.
Recording in progress.
All right, can you hear me now?
Good morning.
Good
Others
morning.
may hear you. You just sound far away on mine.
All right, can you hear me now?
Good morning. Hey, Bill.
Good morning. Hey, Michael.
Sounds so far away.
I still sound far away?
Yeah, to me you do.
Okay. A second. Good morning. Good morning, everyone else. I'm going to be adjusting my audio so we get this meeting started soon. Thank you guys for joining.
Good morning. You sound clear on this end.
Oh, good.
Okay, I do. Okay, thank you.
Okay, good.
Just let me know when Dr. Pitts is on, and I will make him our host. All
Hey,
right.
Bill, will they be able to go over the medication formularies today, you think?
Well,
So,
Dr. Pitts is on, so we be some Q&A time. So I just want to thank
Awesome.
everybody on here. I'm going to give this over to Dr. Pitts. Hey guys, I'm Bill Feggins with Retire EDU Connect. We are a health insurance and life insurance broker firm. So this is a great product. I use it myself. I added this. I've been doing this for 20 years, guys. Okay. And I ordered some prescriptions myself. I have great testimonials. I set up a dentist appointment myself, a chiropractor appointment. So I just want to tell you guys some of the experiences that I have so far with KonnectMD have been great for someone that's been in business, for 20 years doing health insurance. And here at my office, we write a ton of, ACA all day. This is a great add-on product. And I know Dr. Pitts is going to go over full detail and everything, but this has been a great experience, a great product since I had it now. Haven't had any issues. Very easy to use the app myself. Very easy to navigate. And very easy to talk about. So it's been a great add-on product. I didn't have to go to the ER or urgent care. I was able to talk to a doctor in 10 minutes, actually. And it's been a real great experience. So I just want to say that, and I'm going to pass this off to Dr. Pitts because I know you're on there. I'm going to make you the host with the most and let you kick this thing off. I just want to thank everybody for joining us today. And that's all I got to say.
All right. Thank you, Mr. Bill. I appreciate you, sir. Tremendously. Thank you for those testimonies. So, guys, listen, my name is Dr. Casual Pitts. I am the VP of Sales and Business Development for this amazing company called KonnectMD. I been with this company, obviously, since inception. We started out and mastered and dominated the B2B space first. And I know you guys know that term B2B, business to business. And then January 1st of 2025, after we kind of did some tweaks in 2023, We opened up the business to consumer side in 2023, but we still had some things that we had to put into place to really make it a full blown, and it had nothing to do with the service side, it had everything to do with the agency side of the program. So it took me about a year and a half to kind of get that model to where it was going to be beneficial for the field, which I'm going to be going over today for with you guys and answering some of those questions as well. So just giving you a little bit of that back history. And then from 2025 till now, we have about 510,000 lives, active paying lives that are on our program. And it's just been, everything has just been amazing with the program, with the service. So giving you guys a high level overview, ConnectMD is a healthcare membership that's not insurance. It provides 24/7 access to physicians, free prescriptions, and you can add up to 7 family members on the plan for no additional cost. We have 4 membership tiers. Our silver, and let me just do this. Let me share my screen while I'm talking through this so you guys can actually see this. Give me a second. And I apologize. I just get so passionate, I just start going off. All right, so let me pull this up for you guys so that way you guys can get a visual. Hey, Miss April.
Good morning. Good morning, Dr. Pitts. Good morning, all.
Good morning.
Okay. Let's scroll down here. There we go. Okay, guys. So your silver is only $60 a month, and that's going to give you everything I just mentioned, plus dental, vision, and chiropractic. Your gold plan is going to be $80 a month, and that's going to give you everything in the silver, plus access to a free mental health therapist or behavioral health therapist, and 12 access to 12 additional specialists. And don't worry, because I'm actually going to log into a portal to show you guys exactly what it looks like. And then our platinum plan is only $100 a month, and that's going to give you everything in the gold and in the silver, plus access to a primary care physician, a free dermatologist, and then 2 free blood tests that's administered through Quest Diagnostics and LabCorp. And then our titanium plan is going to give you everything in the platinum, gold, and silver. And what's added there is going to be free virtual pet care, medical debt eraser, and then a VIP travel booking engine. Okay. So, full disclaimer, 100% telehealth, right? No hospitalization, no brick and mortar, no MRIs, no CAT scans. Though there can be referrals written out, and based on that based on that primary care physician and his relationship with the referral out, there could be a discount that's administered. With that said, there are 5 services that require brick and mortar. Obviously, it's going to be your dental, your vision, your chiropractic, your blood work, and then if you choose to see a mental health therapist in person, you can do so. Okay. Now, for your dental, your vision, and your chiropractic, that's up to a 60% discount on those 3 services. Your blood work and the behavioral health is free. Okay. Now, the bigger benefit of the program is number one, there's no contracts, no commitments to a member, which means what? For the agency, there's no chargebacks. The second benefit is that there's no social security required. Okay. Which means now your Latino, your Haitian, and your Nigerian market completely wide open. The third benefit is you guys already know open enrollment is closed. With our program, there's no such thing as open enrollment, which means that a member can sign up today and use the service the same day. Okay, so there's no waiting periods. And then last one is there's no previous medical history that will get an individual denied from our program. That means everybody across the board benefits. So now going into how this is structured for the 3 people that we're dealing with every day. Your first group of people are going to be your people who already have insurance, your Blue Cross, your Blue Shields, your Aflacs, right? They already have something in place. And that's great because we're not a replacement, right? We're add-on. So the disadvantages to people who already have insurance right now is number one, they cannot see a primary care physician 24/7, 365. They can only see them from open to close. The second disadvantage is there's you can't add up to 7 people without that insurance going sky high. And then the third disadvantage is there's going to always be a copay and a deductible administered if they want to use any of the services inside of their insurance, along with getting access to their prescriptions. So when they add us in as a supplement, now we help meet those three disadvantages. Your second group of people are going to be your individuals who receive Medicare, Medicaid, and your veterans. The problem with that group is wait times. You're looking at about 45 days to 2 months out for them to actually get a scheduled primary care visit with their particular physician. So what we're providing with that second group is convenience and accessibility. And then your third group obviously is going to be your entrepreneurs who have nothing at all. This becomes an easy add-in for them, and it becomes a primary for them. Okay. So the next thing I'm going to show you guys is a portal, what it looks like when our members get access to the services. And then I'm going to also show you guys the prescription portal because I heard somebody as I came in about the prescription. So I'm going to go over that for you guys as well. So when a member becomes a member, this is what a portal looks like for them. And it's really simple, guys. Let's just say, you're dealing with you got a cough, or you're not feeling well, or you feel like you got some flu symptoms. We're good at self-diagnosing ourselves, right? So to get that guaranteed, okay, this is what's going on with me. Let's say you're just dealing with a situation today. You can just select urgent care. And what you're looking at is a titanium portal. You will select your name. What I love about our program is where you go your membership goes. Unlike certain insurances, if you start to travel out of the network or out of state, you typically can't use it in certain places, right? But with us, wherever you go, our membership goes in all 50 states and all U.S. territories: Guam, Virgin Islands, Puerto Rico, St. Thomas. You're able to use the membership. So let's just say I live in Georgia right now, but I'm literally about to board a plane tomorrow. Not tomorrow, on Wednesday, I'll be heading to actually to April's city. So I'll be going to Pennsylvania. So I will select Pennsylvania. Then I would select either phone or video. I would hit next. I would put in my symptoms accordingly. Hit next. Add whatever additional symptoms to help the physician make the right diagnosis. Then you're answering common questions. They're going to say, okay, within a 2-hour time frame, English or Spanish. Do you need any prescription refills? Are you allergic to any medications? Do you want to add any additional medications? Do you have any medical conditions you want to report? Any surgeries you want to report? Put in your height and your weight. Select your pharmacy based on the zip code that you're going to be in at that time. Hit next. Make sure your phone number is correct. Select the 3 terms and conditions. Quick survey. What would you have done if you didn't have the service? And then hit save and finish. And as soon as you hit the save and finish, you're going to receive an email and a text message. And you're going to be put in queue. And I know it said within 2 hours, but guys, within 8 to 15 minutes, you're going to receive a phone call from that physician. Okay. They're going to assess the situation, make sure they provide a holistic plan first. And if that's not good enough, they're then going to provide that prescription and send it to the nearest pharmacy. Okay. Now let's talk about the pharmacy. So you can go to any pharmacy of your choice. All right. Target, Walmart, Walgreens, it don't matter. All right. So all of our members receive a portal, a prescription portal. Once your portal is set up, you'll log into it. And this is a great tool that you guys would have access to look up a prescription for a potential member before they even actually take advantage of the services. Okay. Log in. And then we're going to look up a medication. One of the most common ones, my mother is a diabetic, so she takes metformin. So here's the category for diabetics. These are all of the top 1,000 prescriptions through our program are absolutely free to the member. So metformin, you just will click metformin. My mother lives in Illinois, Waukegan to be exact. Hit submit, and voila, metformin is absolutely free. If she decides to get this prescription mailed to her home, she has the access to do that. Home delivery free. Now, disclaimer, all chronic medications have to be mailed to your home. Any acute medications, you can go to any pharmacy and pick those up. There's going to absolutely be no cost, and we guarantee if they charge you and they for some strange reason they don't take your card, you'll be reimbursed. That's part of our program because we have had some issues where pharmacies like CVS just didn't want to honor the card for whatever the case may be. It doesn't happen all the time, but level of transparency, it has happened. But our member has gotten taken care of every time, 100% of the time. So that's pretty much the program at a high level, with a high level overview. So before I get into the opportunity side and talk about how much money we can be making with this program by offering it, let me open up the floor and answer any questions for anybody that you guys may have. Now, before we start answering these questions, let me just make sure that I reiterate this. ConnectMD is taking care of 86% of the reason why people go to urgent care in ER, right? Because 86% of the reason why they go there is for the issues that I just mentioned. Sore throat, itchy eye, rashes, cold and flu. Like I literally every week, guys, purposely I sit in urgent cares to watch people walk through there. And not one time have I ever experienced somebody having a chronic issue. Because you know what happens by law? The urgent care facility has to call the ambulance if it's a chronic issue. So I just wanted to just reiterate that. So open up the floor, unmute yourself if you have any questions. Raise your hand if you have any questions in regards to the service side.
I have a question.
Have an answer.
Real quick. I'm sure you do. So as I understand this is a very interesting, actually, program. And thank you for bringing this to us, Bill, too. As the agent of the client, we're going to have access to our own platform to look up things for them and that kind of stuff, like normal. Yeah.
Yes, ma'am. So you would have, as an agency, you guys, now, of course, you would have to have a membership attached to your agency to have that lookup portal that I just showed you. And that's the reason, and that's one of the reasons why we tell our agents to have a membership, right? Because number one, just like Bill, me and Bill had a conversation. He was like, Dr. Pitts, I'm not going to get on board until I try it myself first. And I was like, hey, no problem, Bill. That's what I want you to do. I stand, listen, guys, for those of you who have seen American Gangster, I stand behind my product, baby. Please use the service. I had no issues, no worries. And when Bill started going off about the services, I was like, that was it. And to that point, when a member uses the service, they'll never lose the service. I promise you that. I'm sorry, Miss.
That's okay. That's okay. So in other words, we would have to purchase any of those memberships. Any one of them would give us access, right?
Absolutely.
So if we wanted to just purchase the minimum,
yeah,
because we would not,
absolutely. You would just do the minimum.
It would give us the access to be able to look up doctors, medications, and that kind of stuff.
Yes, ma'am.
So there's no portal that comes with signing on as an agent then. Okay.
Well, yeah. So the only thing you guys will get as an agent is going to be your back office that tracks all your sales. It's going to give you all of your marketing tools, your scripts, everything that you're going to need to push it, whether it's B2B or B2C. And then, of course, you're going to receive a database where you can put in a zip code and it'll pull up all of the companies that you can actually have access to present this service to those companies.
Oh,
because typically those employers are not offering anything. So my system is I have a AI bot system that does all the cold calling for me, and then they get them to accept, and then they send them the forms, and then the only thing I do is I walk into the businesses just to make sure that they're using the services right.
Okay, I want that. I want one of those because my brains are just out to lunch with everything. Wait a minute, I wanted to ask you another question. See what I mean? Okay, well, I won't take any more time. If it comes to me, I'll go back later. Everybody else go on.
Hey, Dr. Fitz, I have a question real quick. When it comes to the formularies, like the medication, we're talking, which one of those memberships is it that I guess covers the medications? Number one, is it any of the membership levels, or is it the $80 or the $100 per month membership that covers the meds?
Yeah, great question. So your silver and your gold plan are going to cover all the acute medications, right?
Okay, and
So,
would that be reasonable to expect like those generics like metoprolol, losartan,
mhm,
amlodipine?
mhm.
Let's say somebody's on a thyroid medication, atorvastatins, cholesterols. Wow, you got me sold, man. Just off the pills because I'm not gonna lie. I'm not gonna lie, personal, self-employed, right? Looking at the cost of like a Torvastat and going, man, okay, I'm either gonna pay $60, $70 for a 90-day supply, or even if I can get a 30 at no cost, man, I'm going online this moment and I'm
Yep.
gonna buy real quick. And then with respect to the family plan, like let's say I want to add my wife, what's the cost differential between yourself and then adding on? I know you said up to, I believe, 7 members. So how does that look when it comes to the pricing?
Yeah, absolutely. So, guys, the price gets higher when you add people. Okay. So the price becomes absolutely $0 for up to 7 people that you add. So every person that you add, there is no cost, guys. So
Wow. Okay.
whatever membership you're paying, those 7 people, it's not per person. So you're not adding them and then counting the dollars to the membership. You're saying, hey, I'm paying a platinum plan, which is $100. I'm going to add 7 people to that, and the cost will not go past $100.
Wow. So I could add my grandmother if I wanted.
That's correct.
So basically, and then would it be okay if my grandmother obviously had a, like if I'm living as an example in Davenport, Florida, and my grandmother, let's say, lives in Maryland, am I allowed to add my grandmother to that like that and like say, hey, grandma, let's get you on that. I know you have that crappy old Alderwood Advantage plan that you refuse to get out of. Let's get you added and make some of those medications, those generics, more cost effective at no cost for you.
Now, absolutely. So let me give you the strategy to that, right? So number one, anybody that's 25 years and under can be added to your personal plan unless and that's an exception with if it's husband and wife, they can be on the same plan. Okay.
Okay.
And anybody that's 25 years and under can be added to the plan. They don't have to, it don't matter where they're at, no matter where they live at. Okay. Now, anybody that's 26 years and over, they do have to have their own plan unless you're taking care of that individual. Now, let me give you that example. My mother is
Okay.
87 years old. I take care of my mom. She lives in Chicago. She's on my plan, right?
Okay.
So as long as you kind of like structure it that way and you're taking care of that individual, so that's your mom. You say, hey, I'm taking care of my mom. She can be added onto your plan. She doesn't have to have her own membership.
Awesome. Hey, let me tell you, when it comes to, and this is cool because I also use AI for my health business, and I also specialize in social security. And now that I know this product is in all 50 states, oh man, so now I don't have to worry about picking up excess licenses. I could technically market this in all 50. That's awesome, Dr. Pitts. That's awesome, man. I appreciate you.
Absolutely. No problem, Michael. I appreciate you, man. Any other questions, guys?
Yes, I have a question. Thank you so much for taking questions. So essentially, a dependent is 25 years or younger,
Mhm.
except if they're elderly. It could be a grandparent, an uncle, an aunt, an older cousin over 26. Now, for taking care of that person, is there an income level required? Let's say I spend a third of my income to take care of that person, and do I have to prove that?
No, no
I could
proof.
just state it. I can just say, oh, yeah, I take care of my grandfather and I take care of his brother, who's my great uncle as well, but they live in two different states
Yep. You
from
can,
myself. Okay,
yeah,
thank
as
you.
long as you state that, you're good to go.
I have a question. So this is Dolores. Hi. Um, so my daughter's 25,
Okay.
and let's say I get her in on my plan, and then she turns 26 in November. What happens? She's
The
still in the
point.
plan, or she has to get her own plan?
Nope. So here's what would happen. Her portal would still work on all the services except for the prescription, right? So even if you're dealing with somebody who's on the plan, the only part that won't work, the doctor will not be able to write that prescription for that member. They'll still do the consultation. Let's do the consultation for your daughter. But in order for her to take advantage of the prescription, see, that's where the HIPAA law kicks in at for us. It's the prescription side, right? So in order for that individual to take advantage of the prescriptions the way that we have it set up, they have to have their own membership from 26 and above. But let's just say you got your daughter on your plan, her services will still work for free consultations unlimitedly, being able to see that primary care unlimitedly. But when it comes to that prescription, he will not be able to administer because he'll say, oh, by the way, your daughter's over 26. I can't write the prescription unless she has her own membership.
Okay. All right. Thank you.
Yes, ma'am. Any other questions, guys?
Yes.
Oh, go ahead.
When you talk about acute medications versus chronic,
Mhm.
for an acute medication, we're speaking about an acute condition, something that happens randomly, it's an emergency, and the medication is needed immediately. So it's per the condition or the reason for urgent care and or primary care. But if it's chronic, it's a medication that has just always been prescribed for the member.
Okay, so when I say acute medications, I'm talking about things like amoxicillin 500, naproxen, um, what was it, prolamine, whatever. I can't even pronounce that. But
Pain medications.
yeah. So these are those are going to be your acute medications, right? Then your chronic medications are going to be things such as, let's see, like metformin is one of them, oxycodone, right?
Metoprolol.
Yeah, exactly. So those are going to be your chronic. So that's what I mean when I say the acute medications and then chronic medications. Now, of course, on the platinum plan, you're getting all of the above. On the silver and the gold, you're only going to get the acute medications, but on the platinum plan, you're getting the chronic and the acute medications.
Okay. An acute medication can also be a medication for a sudden inflammation. And so it would be
Absolutely.
considered an antibiotic then,
Yep.
an acute medication.
Antibiotic. Yes, ma'am.
Okay.
You
So
got it.
pain meds and antibiotics are considered acute medications.
Yeah.
What else is considered an acute medication? Because I keep tying it back to the reason for the actual service or consultation.
I'm going to do one even better for you. I'm going to actually pop in the acute and the chronic medications in our chat box here. Chat box here. How about that?
I
And
see.
that will give you a visual on the difference between the acute and you and everybody, the difference between the acute and the chronic.
So most people then who do have chronic conditions, hypertension, diabetes of any sort, um, they are going to be looking for the higher level
Mhm.
memberships because it can just kind of almost eliminate the cost of your medications.
Yeah, to your point, I have right now we have about 30,000 cancer patients that are on our program.
Oh my gosh,
hmm
that's
And
awesome.
we have about maybe 15,000 dialysis patients on our program. And again, because you guys gotta think, these people who are dealing with chronic issues, they don't want to get out of their bed at 1 o'clock in the morning, all because they feel a pain in their left shoulder or something. And of course, they're in that realm of scarcity because of their situation, right? So every time something happens, they have to kind of they're in already in a chronic state. So they're going through this pain. So being able now to access that primary care in the comfort of their bed and say, listen, doc, I uploaded all my files. This is what I'm dealing with. Can you tell me what are my next steps? And that physician is going to either say, here, either take this, do this, or you know what, based on your symptoms, you need to go to the ER or urgent care immediately.
Okay, thank you.
Absolutely. And I'm getting these files dropped right
So
in.
we're not talking about those ball gown drugs, for diabetes here, like, Jardiance and I don't know. They've just lost, those fancy
Yeah, I know
diabetic
what you're
drugs.
talking
Are
about.
we?
So, but let's talk about that though. So, remember, I want you guys to understand that we're just talking about what you can receive for free, right? But any prescription that you plug into our program, if it goes outside of that formulary, guys, you're going to get up to an 80% discount on. I have people who are on HIV medication. I got one, we just enrolled this member. Now it's been about 30 days. She was on an HIV medication. Her Medicaid was covering the HIV medication to where her copay was $250. And she was okay with that because she needs the medication. Well, she lost her Medicaid based on what just happened with ACA. She went to the pharmacy and had to pay $4,000 for this medication. Well, obviously, she was on Medicaid. It's no way possible that she was going to be able to afford 4,000. Luckily, this is how God works, divine. One of my agents was standing behind her and said, "Hey, it may be a program that can potentially help you with that cost." She was like, "Let's plug in the prescription." She plugged in the prescription right there. Tell me why the prescription went from 4,000 to $80.
What?
Now she had to get the platinum plan. She signed her up inside of the pharmacy, guys. She signed her up inside of the pharmacy. She got the platinum plan, went back up to the counter. And the lady, she said, yeah, she's, oh yeah, we'll apply the discount card. Plugged in the discount card. She had to call her manager and say, I've never seen this medication. I never seen it go down like this. Is this right? The lady was like, does that RN bin code match the group ID and everything? Yeah, we got to give it to her for what you see on the screen. 4,000. She paid $80. So altogether, she paid $180 for that prescription. And keep in mind, she was normally accustomed to paying $250. So not only did we help her situation, but we also saved her from using our plan versus Medicaid, she still had to pay a $250 copay for. So any prescription outside of those formularies that I just dropped in the chat for you guys, you're going to get up to an 80% discount on.
All right, so Dr. So let me just, and I'll be done. So a lot of us do Medicare, as you know. So that Medicare client, they get a lot of times those basic generic drugs can be zero copay. Now,
Right.
some of the fancier generic drugs are going to be maybe whatever, tier 2, tier 3, maybe. Some, I don't know where that all came about, but and then of course the diabetic things, which I'm really concerned about because I have clients that are on that Tresiba and Jardiance and all those kind of things, and they're paying, whatever it is, $200, but it's going towards their $2,100 maximum out of pocket. That doesn't apply to this. Is that correct?
Well, yeah, because typically because our program is separated, right? And that's the reason why you can marriage this with a Medicare and Medicaid and even any insurance, because we're not going to disrupt what you have going on. So if you're going to use our service, that won't get applied to that deductible because there's no marriage there, right? So that's the only two cons when it comes to a Medicare client, is that aspect that you just mentioned, and then number two would be because you just can't go into a brick and mortar, right?
So we're going to compare it. We're going to take that time and compare that drug based upon
there you go.
Each plan and what that's going to cost them, whether they're going to go in or outside that drug network. I got
absolutely. And keep in mind, Ms. Trimble, here's a great selling point for that particular matter. Just think about that senior adding their grandbaby onto their plan now with this program. So it becomes more of a value, not just for them, but hey, you got 7 family members that you know that you would love to add, that you can know that can benefit from this. You're doing the justice from now, bringing that all together into one. That's just a good selling point.
hospitalization. I'm sorry, guys.
No, you're fine. Yeah. So no hospitalization for KonnectMD. Now, let's just say they go to the ER, they get a prescription written from that primary at the ER or their primary that they go visit. Now they can use KonnectMD to go pick that prescription up for free.
Right. But if they have to go to the hospital, there's no coverage for them in this plan. They're going to have a separate hospitalization plan. Okay. Got it. Thank you.
Let me give you an example of what happened with a teachers association in Florida, 10,000 teachers. This was before January 3rd. They had to have their cutoff to make their decision. They heard about our plan. I did a presentation for them like I'm doing for you guys. It made so much sense to them. They said, now we know what we're going to do. They got a catastrophic plan, which was affordable for them. and then added this in as the supplement to make up for the things that they needed it for. And it was more beneficial because now they were able to add their other family members to this plan. They didn't have to add them to the main insurance, which gave them a better cost, better cost at the entry level. And right now, because they've been with us now for about 3 months now, and right now the utilization on the insurance is almost at zero. They've been using ConnectMD more, so you can only imagine what's going to happen at the end of the year. That association is going to save so much money because we literally have dropped the utilization rate for them.
Hey, Dr. Pitts, got a question real quick.
Yes, sir.
When it comes to, because I work also business to business on those EHP programs, the one where it's saving them on the FICA, yada yada. Here's a question for you on, let's say not those groups, the groups that wouldn't qualify for EHP. Let's say it's an employer, 20 people, they don't even qualify, right, for let's say EHP, or 18 people, whatever. Is there a B2B product with ConnectMD that could be linked or could go through that angle, or would it simply just be like a bunch of one-off sales with the W-2s, or how could that be structured if you were walking in to a group and he's like, hey, Mike, you know what? My people don't qualify for your cool EHP because we don't have those, we don't have that ACA requirement set up. Can ConnectMD, is there a way for me to promote ConnectMD to give it to the employer, let them pay for it, or are there other options or ways that you recommend?
You guys can see my screen, right?
Yes, sir.
All right, so y'all know if I'm about to share something, I got an answer for it, right? Okay. So let's go here really quickly because I want you guys to see this because this is powerful, right? So remember I told you guys we dominated the B2B space, right? That was where we
Yep.
started at. Okay. So if we started in the B2B space, surely we got to have something for the B2B for the employers, right? So giving you guys an example for an employer, they can get any one of the plans free for 30 days. Free for
Nice.
30 days, right? They no contracts, no commitments, nothing that they have to commit to. They just got to tell us the employee size, and they can get these three plans, which are different prices, except for the basic, right? Your state where they're going to save money at is going to be the standard and the comprehensive, starting with a minimum of 5 employees.
That's sweet. And just one other question for you, super quick. On the program, on the individual program, I know there's the 100 per month and the 150. The program, if I was looking at the one that cover, like for example, myself, like I was blessed at 40 some with the diabetes type 2 and then the high blood pressure. So would the $100 a month plan take care of that, or would that be the 150 per month?
Um, Say that question again. I'm sorry.
Yeah, no problem. So I have like slight high blood pressure, so I take metoprolol as an example, and I also take metformin 500, right? So would that cover me on the plan that's 100 a month or the one for 150 a month?
The platinum, because the only thing that you guys are getting at the 150 level of transparency is just going to be the pet care, the medical debt eraser, and the VIP travel booking engine. Those are really just the three add-ons that's going to be added at that 150. Everything else,
Okay.
the platinum plan is really the core. It's I call it the Rolls Royce of ConnectMD.
Okay. So
Yeah,
basically the 100 a month, you're good to go.
yeah, 100 month, you're good to go,
Man,
100%.
you're awesome, dude. Your company's awesome because I would be thinking, oh, okay, from a sales standpoint, let me grab the 150 deal. But you're telling me, man, you guys are awesome. So you guys are even better than I think. 100
Yeah,
bucks a month, man. I'm
100.
telling you, man, all the pills that I'm going to go pick up today between me and my wife, I'm going to go sign me and my wife up. You're hearing this, Bill. I'm going to be signing up within an hour. Thanks, Dr. Pitts.
Absolutely, guys. Okay, so I just got the notion. I'm gonna move on, guys. So hold your questions until the end. So let me move on to the opportunity side with ConnectMD. I'm going to let me pull up this document first. I'm gonna share my screen so that way I can give you guys a full scope. Again, I want you guys to be visually see this. So give me a second. Mm-mm-mm. Okay. Mhm.
while you're looking for that, I'm just going to say that when I did lower my prescription drug costs when I called in and got some testosterone propionate, it was way cheaper working with KonnectMD. So that right there was a savings for me because it was hundreds of dollars less. So that blew me away. And also I looked at the dentist and I picked a dentist just to try it out. I don't have an appointment till next month, of course, but it works. So anyway, okay, well there you go with Dr. Pitts. All right,
Yeah,
I'm
no,
done.
no, no. I appreciate that. Thank you, Bill. Okay, guys. So really quickly, let me move these boxes away. Okay, so number one, to have your own agency, as we mentioned before, it's very, very expensive, and it's $25 a month to set your agency up. Okay, and if you need to put that on a payment plan, that's fine. But no, so it's $25 to set your agency up, and then of course, we legally we can't tell you to get a membership, but I think you guys can understand. Based on Ms. Trimble's, example, having a membership is going to be beneficial for you to navigate, for you to recommend. So I don't need to tell you guys the disadvantages of not having one. And then, of course, on top of it, you using it yourself and then you being able to have it for you and your family, right? As an additional addition. So with that being said, once your agency is set up, there's three major benefits. Number one, because this is not insurance, you guys don't need a license. All right. However, there are courses that you can take at your own pace that helps you feel more comfortable with how to promote, advertise, and market this to your particular audience. Your second benefit is no chargebacks. So if a member signs up today and they cancel next month, no harm, no foul to the member, no harm, no foul to you as the agency. And then the third benefit is going to be your CRM system, which tracks all your sales, your marketing university, which gives you all the marketing tools as you guys were able to see for an agency. And then, of course, having that database where you can put in the zip code and pull up all those companies that are looking for the services that we offer. Now that your agency is set up, you're going to put yourself financially in a position to make a $35 bonus from your very first sale, no matter what membership somebody enrolls into. And then you're going to make 25% of that membership month after month. So in this example, as you see the illustration on the screen, if you enrolled 500 members into your agency, that would be a $17,500 bonus up front. And then either 7,000, 10,000, 12,000, or 18,000 month after month for the lifetime of that member, as long as they are an active member. Okay. So the the benefit of making money with this program, it can get big real fast. Now, what you see on this screen is what you guys personally can accomplish, right? This has nothing to do with team building. This is everything that you say, hey, this is my agency. This is what I'm going to do. You can literally build your book of business in what we like to call true residuals. Now, if you say, you know what, just like Mr. Feggins did, he opened up the call for you guys to come on board. You guys can open up and bring on other agents to your agency to have them have their own agency. Well, because this is not your MLM where you got to get five and to rank up, you don't got to do all of that. However, which means that we don't get paid to recruit people, is what I'm saying, which is great because when you think about insurance, like you guys are already doing, that foundation is the most solid foundation in the world because when was the last time an Aflac shut down or an Allstate shut down? And you know why? Because they don't get paid to recruit people. But you do get a percentage of the book of business that your agents write. So your level one agents, you're going to make 5% of the book of business that they write month after month. Your level two agents, you're going to make 3% of the book of business that they write month after month. Your level three agents, you're going to make 2% of the book of business that they write month after month. And levels 4 through 10, you're going to make 1% of the book of business that they write month after month. So again, guys, that is the opportunity of having your agency set up, and the income can be extremely endless. I'll give you an example. One of my first big accounts when I created this comp plan is I enrolled the NAACP who had 1,000 constituents in their organization. They all took the platinum plan. Okay. So I got a $35,000 bonus, and bonuses are paid out weekly. So your upfront commission at 35 upfront commission, that's paid weekly, and then passively month after month. I was paid 25,000 month after month. That was my first big account before the snowball effect started to happen. So Now I will digress and answer any questions that you guys may have.
Well, this is Jody Jackson. I have a cousin that has her husband, he has dementia. And I know one of his medication was very, very high, about $400. And I know his wife could not afford it. But do that cover dementia as well? And she has a sister that has lupus. Will that cover as well?
Yeah, my sister has lupus, and her medication for her lupus was $700, and she doesn't have insurance at all. Our program brought it down to $210.
Wow, that's awesome. Real quick, what was a level one percentage again?
5% of your level one,
Mm-hmm.
3% on your level two, 2% on your level three, and then levels 4 through 10, 1%. Which
And
means
what? Oh, I'm sorry. Go ahead.
no, which means that you can build as wide as you want, 10 levels deep. Go ahead, Ms. Trump.
So that's what you're talking about. Level one is across the board. Then when your agents recruit somebody, that's your level two. So, okay, got it. Got
There
it.
you go.
Sorry.
There you go. Yes, ma'am. No, great question. Any other questions, guys?
I was going to ask real quick when it comes to like recruiting, and I was just thinking outside the box, right? So take like a small pharmacy, like someone that's not like a Walmart, but I don't know,
The
just a
local
normal.
pharmacy.
What's the deal with? I know the whole deal with HIPAA. Is there a reason why that you could think of why a pharmacist couldn't? I know they're not really supposed to like refer out, but is there any reason why a pharmacist couldn't be added under you as long as the farm? I know from a point of compensation, but do you think, have you heard of any referral partners or any downlines being able to sign up a pharmacist and then that pharmacist could be like, hey, try these guys out? And then obviously the pharmacist is going to make money and I'm going to make money, but is there anything that you've heard of from a compliance standpoint that would keep a pharmacist from being signed up under you to be able to bring this service, valuable service to their clients?
It would be a private pharmacist, right? You're speaking about?
Mm-hmm.
Yeah, yeah, not like yeah, we're not talking about a Walmart person. We're talking about like Jody's Pharmacy LLC in like let's say Orlando and Bob the pharmacist, all independent folks.
Okay.
Yeah. Yeah, because and thank you, Miss Stephanie, because I know you was gonna step in if it was Walmart because we couldn't do it with them. But so I have about 30, I have 30 agents that own their own pharmacy. That are
Nice. Okay.
yeah. So they're able to take advantage of the program.
Man, but I could literally just I could pull up probably what 200 pharmacies in like Orlando, Kissimmee, different areas and just hit the field and say, hey, look, I'm not gonna lie, man. My pharmacist in Walmart's awesome. She would love it, but unfortunately, it's the Walmart deal. But
Yeah. Yeah. Now, also too, giving you guys another to that point, urgent cares can be enrolled as agents, and the selling point there is they're only going to typically see that particular person, even though they have a file case on them. They're probably only going to see them maybe one to three times within that year. So what happens within the rest of those months, right? So showing an urgent care how now they can offer a membership service to a client that now leaves out that door can now benefit month after month, right? To now having that attachment to that particular client. So it kind of keeps them, in the wheelhouse. Just giving you guys an example, that was one of those particular sales tactics that I just created about a month ago, where I said, you know what, let me see if I can close this deal, and I wind up closing one urgent care, and now I have 11 under my belt. So you got to think they're seeing people every day, all day. So it's a great referral for them.
Dr. Pitts, if you have a doctor that doesn't take any insurance, but you have clients that like to go to that doctor even though they have insurance, is there some kind of reimbursement thing that can happen for that client if they see that doctor who doesn't take any insurance? Or does
No,
it, or
no.
so they, I probably have that backwards, but go ahead.
Yeah, I think I know what you're trying to say. So I'm, for you guys know, my DR, I'm a holistic practitioner, right? So I have a spa. I have 3 spas, one in Georgia, one in Florida, I mean, one in Chicago, and then one in Houston. So what I did was I added this benefit to my website. And now I tell all my patients that if they take a membership, I can give them a discount on any of the other services that I offer inside of my spa, right? So that's typically how that situation will work, where we would approach that particular medical doctor who doesn't take any insurance and say, hey, if you on board your particular patients with a membership, then you can potentially offer them some sort of discount from the services that you're already initiating through your particular facility.
Okay,
So
thank you.
if you know like a person that is like in the holistics that offers certain types of medications, you know, like those healthy non-medications,
Supplement.
yeah, you could like really kick tail with that because I mean some of those guys are like really go hungry and you're like, hey, look, you're helping your people right now, right? Stay healthy without trying to have all the crazy pills, but the other services and then the medications that they're gonna have to take to survive, right? I mean, it could be a humongous because a lot of times those guys have a humongous downline that could already attach to several hundred reps already.
Yeah. Yes.
Awesome. Okay.
Mrs. Mirabelle, you got your hand up.
Hello, everybody. Sorry, I have a baby in the background. My question, because I'm bilingual, I'm always going to ask the question. Hi, Bill. Thank you for bringing us this meeting. For people that are undocumented or people that have green cards, are they eligible, or what's the process for some of those people?
Guys, I'm so sorry. I should have spelled that out at the very
You're
beginning.
good. I'm going to bring it out.
No social security required to take advantage of this membership, which means our Latino, our Haitian, and Nigerian market completely wide open. And believe it or not, guys, and I'm sure you probably are aware of this, that is our second biggest market right now, is the Hispanic market. When I tell you they love this program, they love right now. Our utilization this morning was probably from my Hispanic side this morning.
So are we registered? I mean, once we've signed up, we will be registered to do it in all 50 states,
All 50 from the time
including
you
Puerto
guys
Rico,
hit.
the Commonwealth.
Yeah, yeah. As soon as you guys hit the submit button, you guys are activated to market, advertise, or promote KonnectMD in all 50 states and every U.S. territory.
Beautiful. Thank you very much.
Absolutely.
Dr. Pitts, can you talk a little bit about the material in the back office? They got marketing material and also how to join too. I put that in the chat too for everyone because I know I get a lot of people that's texting me right now. How do I join? And I sent you guys emails already, the steps, and I put it on the chat too as well. So maybe you could go over that a little bit too. So they have some, and also you have training too, because you have trainings, Monday nights. So maybe they should understand that, like the people who join today, I mean, $25, guys, you guys can join for $25. I encourage you to get the membership. I did for $25. You can't beat that. And Dr. Pitts has great training at night. So if you could talk a little bit about that too.
Absolutely. So, guys, just giving you an example, this is your resource center, right? This is what you're gonna have access to. Okay. So let's start from the very beginning. We have a convention that's coming up in June. You guys, let me tell you something. I'm so glad that Bill brought this even up. When I tell you that I can almost guarantee you that come June, the new feature that we're about to get ready to add to ConnectMD is almost going to almost guarantee you a sale from day one when you walk up out of there. Like our agents are going to be so on fire. I wouldn't be shocked if Florida get lit up completely with this new feature because everybody is going to be out speaking to somebody with this new feature that we're going to add. Okay. So that's a teaser for you guys. But that's going to happen in June. So that's what you see the momentum at the top for. Here's a certification course thing that I was telling you guys about where you can get in and it's going to give you 3 courses that's going to help you again be more comfortable with talking about ConnectMD to people. This is our power hour that happens every Monday night. So believe it or not, for all of you that's going to be enrolling today as agents, you guys will be able to join us tonight and you will be able to hear and feel the energy that is going to be in the room tonight. And I thank you, Bill, for that. I do I do think I give great trainings, but people love my trainings because I keep it simple. Guys, these are not going to be dragged out trainings that I do. You're literally talking about 8, maybe 10 minutes tops every time I do a training because I don't have time to lollygag. I want to get to the issue. I want to create the solution and get you guys to a success really, really fast. But that happens 7 p.m. Central Time, 8 p.m. Eastern Time every Monday night. And then every Wednesday, I release a new training that goes into our YouTube channel called Beast Mode. And then here's your resource directory. So this is our Facebook group. This is our Telegram group. Resources for individuals, resources for businesses. Here's our Spanish resources for those that are Spanish. And then, of course, like I say, we're promoting our convention. But everything you're going to need is going to literally be supplied in your back office. Now, I'm going to just give you guys a high-level walkthrough on enrolling really quickly. I just want to walk you guys through this. Guys, when I tell you it takes 2 minutes, it takes 2 minutes to enroll into a member, and it takes 2 minutes to enroll as an agency. Okay. So matter of fact, I'm gonna do one even better for you guys so you guys can see the channel as well. So let me unshare and make sure I'm sharing with audio. Give me a second. Okay. Now let me share well for you guys. Bam.
Excuse me, I have one more question.
Yes, ma'am.
Okay, say for instance, you sign up for one, like the lowest package, and then you decide you later on you want to go to the higher one, which is 100. Can you do that?
Absolutely. So great question. Guys, you can upgrade and downgrade, no penalties, right? If you start out at the low, and let's just say 2 weeks, you want to upgrade to the platinum, you're not paying a new enrollment fee. You're not paying the new cost of that. You're going to pay the difference. So it's going to be prorated, just so you guys know. Okay. Really quickly, guys, as you can see, 2 minutes and 56 seconds. Hello, my name is Dr. Casual Pitts, and today I'm going to give you guys an overview of how to enroll as an ambassador with membership. So your particular ambassador has sent you a replicated website, and one of the things that you want to pay attention to first is making sure that that ambassador's information is here at the top. It should say your sponsor and either their name or their business. So step 1, you're going to click on ambassador. Step 2, you're going to click on become an ambassador today. And then you're going to fill out the appropriate information as you see fit. Now, for the unique referral link, you're going to always want to put, just to keep it simple, the first name and the initials of your last name. Now, step 3 is you're going to fill out some additional information. But what's important here is, again, making sure that the sponsor's information is here. And let's just say it's not. You'll just click on not your referral person. You can either search them by their member ID or their last name and hit search. And then it'll populate them here, and then you can just hit select. Put in your information. Make sure that the billing address is going to match the card that you're going to use to check out. Hit continue. And step 4, you're going to select build your custom order. Select this item here. And then already there's going to be a 1 pre-selected in your monthly back office. There's going to be a 1 pre-selected in your enrollment fee. And then the only thing you're going to have to do is pick a membership of what you want to partake in. So it can be the travel program, the lifestyle club, the lifestyle, and it's the lifestyle plus GLP, the lifestyle club, so forth and so on. And then here's your silver membership, your gold membership, and your platinum membership. For this example, we'll select the platinum. And all you would do is just click on quantity, put a 1 there. And then after that, you scroll all the way to the bottom. And that would work if you wanted to add any additional services. But for this illustration, we're just going to add the platinum membership. You'll hit continue. And then step 5, you'll put in your social or EIN number, whichever you choose. You're going to make sure you select all of the pre-selected boxes. And then here's where you're going to select what card you're going to be using. Once you select the card, then you're just going to put in your appropriate information as you see fit. And then you're going to hit complete enrollment. And once you complete enrollment, this is what you will see here. Congratulations for your enrollment is complete. And that's how you become an ambassador with membership. All right. Any last minute questions, guys?
Yeah, so if I wanted the plan myself and I wanted the basic, the very bottom, and then I wanted it as an agent, that's going to be $85 a month, right? 60 plus 25.
That is correct. 60 plus
Okay.
20. Yeah, that is absolutely correct. Yes, ma'am. And guys, when you think about the amount of money you're going to be making, like these entry costs are like literally slim to nothing. When you think about like insurance itself, I think Bill and April and all of you guys can attest to what the fees that you guys already have to pay on an agency side. And I don't know if that's monthly, I don't know if that's annually, I don't know what that is, but again, the amount of money that you're going to be making here, guys, it's better to have our membership and not need it than to need our membership and not have it. And if you don't get it now, that experience is gonna kick in, and you'll be like, I remember when Bill had us on his Zoom. Let me sign up for this service now and use this service now, right? So,
Hey, Dr. Pitts, just the
yes,
savings from the medication. If you look at like people, like, because I do the private healthcare, so even a lot of times they'll tell people, oh, you take too many medications, it'd be better to go ACA, right? But even if you have to keep them in ACA, that's perfect because just the cost of the pills on that end. And then on private healthcare, the plans on the formulary anyway are more expensive. So you could literally sell this. The way that I look at it is like medication just for medication purposes between Medicare, the supplement folks, the private healthcare, and the ACA. Just the pills are a savings. And then you throw in everything else. You're like, look, this $100 a month is going to at least be worth the medications that you're throwing every month. Plus, everything else is just an added bonus.
absolutely.
And
Absolutely.
I want to say this. Thank you so much, Dr. Pitts, too, because I know that you got to jump, and I know it's
Yeah.
things that you got to do too. So I just want to thank you. This has been recorded, guys. I will email everyone that registered. Also, I already emailed you prior to this webinar those same steps that Dr. Pitts went over. I will actually send it again, also with that video, so you guys will get it again. And whoever joins, then I will send you the Zoom link tonight for the training tonight at most of you guys are Eastern. So I would say 8 p.m. Eastern, because I'm going to send this out to hundreds of brokers of mine. And guys, we only for ACA, we only make between 25 and $35. You know that, Dr. Pitt, that's what we make on the exchanges. It's 25. We make 25%. Yeah. Up to $35 most of the time. Yeah. So, and it's a much harder process too, because we got to help them get subsidies and other things too. So don't think that this is
That's
why it's such a
monthly,
great.
but is that
Yeah,
monthly?
it's monthly. Yeah, we'll get it
Oh,
monthly.
okay.
But people jump off or it costs too much. When you sell health insurance or insurance in general, people ask you every day, "Hey, can you get me some coverage?" And those healthy entrepreneurs, those ones that's not on Medicare, those ones that's not on Medicaid, that gap is usually where this fills in at, guys. And those people ask us all the time, my insurance went up, extra $200 a month. But I added this because it makes sense, because I have to hit a deductible, if I do go to urgent care, guys, still costs $120 to see the regular doctor. So sometimes I just just the PCP. So understand this, guys, there's a huge market for this and opportunity for this. And you said the persistency on these policies, on these plans, not policies, these plans are close to 90%. So they're staying on the books because it's needed, because they're using it and they're talking to doctors. So it's a win-win. Some people are going to get it on here. Some people won't. Some people will remember it, but you guys will follow my YouTube page and you guys will see it. Send it to your friends and everyone else. If you're trying to build a team, I'm building a team. I mean, it just makes sense to us, especially if you're selling ACA. Some of you guys on here have hundreds of ACA clients. Call them up and add this. Yeah, hundreds and hundreds of them. Some of you guys. So add this as an add-on benefit. Talk about that. And yes, I know somebody put on there as their dental network. Yeah, I've seen it. It's in the back office. You will see the network. You can put in your zip code and you can see the dentist and the chiropractors. Why? Because I've done it and I'm a veteran. So it's there. So I just want to thank you for that. I really appreciate it. I'm going to email you guys right now. You guys will see it. I'm here in the office. I got nothing else to do right now, but send that out. And get that over. And I'll see you too Wednesday too, Dr. Pitts, at the Small Business Expo, because I'm gonna come past there.
Absolutely.
Yep.
Well, look, guys, thank you. I do have to jump off, Bill. I appreciate
Thank you.
guys tremendously. Thank you, guys. And I'll
Thank you,
be
Dr.
here.
Pitts.
Hopefully, I'll see some of you
Thank
guys
you
tonight.
so much.
All right, guys.
Thank you. Bye-bye.
Yeah.